Hi, my name is Michelle Wieber. I'm a physical therapist and certified athletic trainer, and I have Rachel here with me today. And we're going to demonstrate blood flow restriction therapy. So you can see she's been wrapped in these blood pressure cuffs in her upper thighs. And you could certainly do this in the upper body as well, around the upper arms with a different size cuff. And then I've got a blood pressure device which I'm going to pump up. And I'm first going to start by finding out what her 100% occlusion pressure is, and then we'll do some calculations and exercise at a lower pressure today. But blood flow restriction therapy has been around for about a decade in the bodybuilding community and has recently been converted and researched for the medical community. And there's some great research we'll talk about as Rachel starts to exercise that really supports the use of blood flow restriction therapy in rehab. All right, so I've got a Doppler here and I'm going to find her heartbeat. There it is. And now I'm going to pump up the cuff around her right leg until that goes away. So that whoosh whoosh will go away. And that's at 140. So that's for her 100% occlusion pressure is 140. Now if she's going to exercise, I'm going to choose something between 60 and 80% in the lower body and 45 to 55, 60% in the upper body. So I'm going to drop this down and you can hear how the heartbeat comes back, but if I pumped it back up to 140, it's gone. So now I know 140 is her 100% occlusion. And now I'm going down to about 120. Then I'm going to pump up the other leg. And for the sake of demonstration today, I'm just going to take her straight up to 120, but you would normally reassess the other leg for its max occlusion as well. Good. Right there. Get some gel off of her leg. And Rachel's going to start some bridging activities. Rachel, what's it feel like right now?
Just pressure, there isn't really any pain.
Not any pain. Okay, good. Bend your knees. Good. And then you're going to lift your hips 30 times for me. Yeah, you can pull your socks back on. Great. So while Rachel's doing that, when we look at building muscle size, which is the definition of strength and improvement in the cross-sectional area of a muscle, we are looking at training someone with a certain amount of weight. And that amount of weight tends to be between 65 and 90% of their one repetition maximum. But sometimes that amount of weight is too much if somebody is beginning a rehab program, or if they have a really sensitive joint, or they tend to get swollen when they exercise. And that's where blood flow restriction therapy comes in and is so handy. On the other side of the spectrum, we were just talking about high intensity. What about low intensity exercise? What about the person that goes home with their 2-pound bicep curls? Well, they're really not changing the size or the diameter of their muscle. And so they're really not necessarily getting stronger. They're not going to be able to lift more. But again, maybe they're doing that just to keep things moving, or maybe they're doing it because they tend to get sore with exercise. And again, that's the other way that blood flow restriction therapy can be used. How are you doing?
One more.
One more. Okay, now Rachel's going to take a 30-second rest. So this is a bridging exercise. I would say for an athlete, they would probably consider it on the low intensity side, not the high intensity side. And so why would we have Rachel do this? Because maybe she's having some knee pain. Maybe she's having some back pain. Maybe she isn't able to work out right now. And this is a way that she can stay in shape. So when we look at the research, when we do blood flow restriction therapy with low intensity exercise, we have the capability to produce enough changes in the chemical makeup of the leg that it actually causes the increase in cross-sectional area. Go ahead, Rachel, you got 15 more repetitions. So that lactate production, which we see with high intensity exercise, which we tend to think of giving us that soreness in the muscle like we worked out, we still get the lactate production when we do low intensity exercise with blood flow restriction therapy. We will never get it if we simply do low intensity exercise. That lactate production is part of the chemical soup that causes our body to change the muscle size. We also don't get type 2 muscle fiber recruitment when we do low intensity exercise. We do get it with high intensity, good, 30 seconds of rest, and we get it with low intensity if we use blood flow restriction therapy. So really interesting. The next thing would be that the growth hormone is about 100 times when we do high intensity exercise. And that actually is involved with your pituitary gland in your brain. But with low intensity exercise, you do not get growth hormone. With low intensity exercise, with blood flow restriction therapy, you get a 1.7 time increase in hormone production above the 100 time increase that you get with high intensity exercise. Okay, Rachel, another set of 15. It's going to start getting a little harder. The other thing we see is that in the cross-sectional area that we have incredible increases in the speed with which people get adaptations. So in a high intensity platform, we usually see that there are adaptations in the muscle that really are becoming very evident in cross-sectional area and other ways at about 12 weeks. And with blood flow restriction, you can see that happen in as little as 3 weeks time. So low intensity exercise, great, Rachel. How hard is it getting?
It's a little hard.
A little hard? All right. You just have one more set. You think you can do it? Mm-hmm. Okay, we'll give it a go. One more set of 15 in about 20 seconds here. We know based on the research now that's come out about blood flow restriction therapy that you can have tendon remodeling that improves and is sped up by using this with exercise. You can have bone remodeling that you can possibly improve the speed with which a stress reaction or stress fracture or other fracture would heal. That the body, through the chemical soup and hormone influences with blood flow restriction therapy, actually produces capillary angiogenesis. It develops more blood supply in the legs or the arms. You have more collagen, you have decreased scar formation, and lastly, increased muscle protein. And that's what all the research is showing. Now, Rachel, you got 15 more, and you'll be done. Do you remember the first time when you did this?
Yeah, it was really hard.
Really hard. But you were just coming back from an injury, right? Mm-hmm. So that would make sense. Again, this is an example of a relatively low intensity exercise with blood flow restriction therapy. It can be used all throughout the body, and the benefits aren't only in Rachel's legs, but the benefits even are in her hips, near the cuffs, and also in her aerobic capacity. So if you're interested in learning more about blood flow restriction therapy and whether it would be appropriate for you, please give our office a call. We'd love to talk to you about it and share our new technology with you.